Hey guys, welcome back. I'm so excited to have you with me here today. So today we're going to have Study With Me NCLEX Prep 2020. So guys, if you have your Saunders book, let's take them out. For your Saunders PN examination, Study Prep for NCLEX. So you're going to want to open your first page and you're going to want to scratch your access code off. And we're going to actually log in on, I'm going to log in on my iPad because it's going to be easier for me to go through questions with you guys and explain the rationales towards them, with them. So we're going to go to evolve.com. And this is how it should look for y'all. Sorry, my screen is a little bright. Okay, we're going to go to Evolve. We're going to sign in with either your username or email address. Sorry guys, it's taking me a little minute. For some reason, my login wasn't working. Guys, we have it. I was putting the wrong password in. So once you log in, your screen should look like this. And I'm sorry for the quality, guys. I'm using my laptop. This is how it's going to look. So you're going to scroll down and go to Evolve Resources for Saunders Comprehensive Exam. Going to click that, and it's going to take a little second to load. Then you're going to select the quiz. NCLEX includes testlets. And you're going to click open. So you guys, if you're a first-time user, for you accessing this code, they actually have, when you first log on, the assessment mode would consist of 75 questions. It generates a study calendar for you. It basically offers you a pre-test and a post-test to see your strengths and weaknesses when preparing for the NCLEX. When I studied for the NCLEX, I actually did the pre-test and I did okay, not as well as I thought I was going to do. So I did that and I looked at the study calendar, but I felt my weaknesses weren't what I actually was evaluated on with the pre-test. So I pretty much made my own study regimen. So let's go on. We're going to click continue. So we're going to go to the study mode first. And when I studied, I actually went by, content area. So in the content areas, they have adult health, critical care, developmental stages, fundamentals of care, managing client care, maternity, mental health, pediatrics, as well as pharmacology. So because it was in that order, I was like, well, I'm going to just go down each list and study like that. So we're going to go today to adult health. Okay. So first question. The nurse is assigned to assist with caring for a client after cardiac catheterization performed through the left femoral artery. The nurse should plan to maintain bed rest for the client in which position? The choices are 1. High Fowler's position, 2. Supine with no head elevation, 3. Left lateral sideline position, 4. Supine with head elevation no greater than 30 degrees. So I'm going to give you a second to answer that question. So the correct answer is supine with head elevation no greater than 30 degrees. So the reason for that is because it prevents the client from obtaining a hematoma, and it also prevents occlusion and bleeding. and it's also the most comfortable position for the patient. If you have the patient supine with no head elevation, then that patient may not be comforted as much as they can. Next question. After a client undergoes a liver biopsy, the nurse places the client in the prescribed right side lying position. The nurse understands that the purpose of this intervention is to accomplish which? Number 1, promote bile flow. Number 2, limit client discomfort. 3, promote hepatic glucose storage. And 4, limit bleeding from the biopsy site. So let's pause. When reading this question, what they're trying to figure out what is the best purpose for this intervention. So we do understand that the patient had a liver biopsy, which is invasive. So there could be some possible bleeding, right? So when you look at your choices, you want to look to see what would prevent the most detrimental effects from happening to the patient. So we can pretty much eliminate all 3 first choices. So you want to select the choice that says limit bleeding from the biopsy site, because the patient could have a hemorrhage due to having the liver biopsy. Okay, let me know if y'all with me, guys. The nurse is assisting the insertion of a nasogastric tube into a client. The nurse should place the client in which position for insertion? These are our choices. 1, right side. 2, low Fowler's position. 3, high Fowler's position. 4, supine with the head flat. So let's pause. The importance of the insertion of the nasogastric tube is normally used for patients who are NPO and need to obtain some type of fluids or take their medication that way. So we're inserting a nasogastric tube. We know they cannot be lying flat, right? And why is that? Because they are at increased risk for aspiration. And also, when you're inserting the NG tube, it can actually puncture the lungs if you're not going in properly. So you wouldn't want any position that's low or flat. The patient must be sitting up at least from a 45 to a 90-degree angle. That sounds good? Okay, let's go to our next question. The nurse is providing endotracheal suction to a client who is mechanically ventilated when the client becomes restless and tachycardic. Which action should the nurse take? Select all that apply. Okay, you guys, here goes those select all apply questions. Number 1, notify the RN. 2, notify the rapid response team. 3, finish the suctioning as quickly as possible. 4, discontinue suctioning until the client is stabilized. 5, contact the respiratory department to suction the client. So let's see what's our choices. Number 1, notify the RN. Because we are LPNs, it is very important to be able to communicate with our colleagues. So the RN, of course, would be in charge, will be working underneath the RN. So you definitely want to notify your RN if your patient is having a change in vital signs, especially if they're becoming restless and tachycardic. That's a very serious sign. 2, notify the rapid response team. That isn't necessary because your patient is only restless and tachycardic. So if you pause suctioning, give them a few seconds to regroup and see if their pulse oximetry goes up, it should be fine. So you do not need to notify the rapid response team because the patient does not need CPR. Number 3, finish the suctioning as quickly as possible. You definitely do not want to continue suctioning that patient because you're taking oxygen from them while suctioning. So that's a no-go. 4, discontinue suctioning until the client is stabilized. And that is very important that you pause the suctioning Let the patient regroup and look for those vital signs to become normal. Number 5, contact the respiratory department to suction the client. And that isn't necessary because you can suction the patient once their vitals become stabilized. You don't want to call respiratory to come suction them if they're still unstable. Okay? Sounds good? All right, let's get rolling. Next question. So this is very important. I received a lot of questions on my NCLEX that dealt with delegation as well as privacy, HIPAA, confidentiality. So this next question is surrounded around that. So let's get to it. This question states, a nurse lawyer provides an education section to the nursing staff regarding client rights with emphasis on invasion of the client rights. The nurse lawyer asks a nurse to identify a situation that represents an example of invasion of the client's privacy. Which situation, if identified by the student, indicates an understanding of a violation of this client right? So you guys, before I read the answer choices, remember, we're looking for a choice that explains invasion of a client's privacy. Answer choice number 1, threatening to place a client in restraints. 2, performing a surgical procedure without consent. 3, taking photographs of the client without consent. 4, telling the client that he or she cannot leave the hospital. What is the correct answer? So the correct answer is taking photographs of the client without consent is considered invasion of privacy. Person threatens to place a client in restraint. That is an example of assault. Performing a surgical procedure without a consent is an example of battery. Of course, taking photos of the client without consent is an invasion of privacy, right? You wouldn't want nobody just to start taking pictures of your wounds without me consenting that, okay, it's fine that you take pictures and put that in my chart because it is the right of a client. And 4, telling the client that he or she cannot leave the hospital, that's false imprisonment. You cannot tell a patient that they must stay in the hospital. It's their choice if they decide to leave against medical advice. All right, guys, I hope that's helping y'all work through these questions. Definitely get, I personally did get questions dealing with nutrition. So here this question goes. The nurse is instructing a client on how to decrease the intake of calcium in a diet. The nurse should tell the client that which food item is least likely to contain calcium. Keyword, least likely to contain calcium. The choices are milk, butter, spinach, or collard greens. Which food item is least likely to contain calcium? The answer is butter. Milk, spinach, and collard greens are extremely high in calcium, so you would want to tell the patient to restrict foods in these type of items. On NCLEX, you'll get a lot of questions dealing with the need for further teaching. So here this question goes. A licensed practical nurse is precepting a student assigned to care for a client with chronic pain. Which statement, if made by the student, indicates the need for further teaching regarding pain management? So need for further teaching means that isn't correct. That is not what you would teach. Okay? Here are the choices. Number 1, I will be sure to ask my client what their pain level is on a scale of 0 to 10. Choice number 2, I know that I should follow up after giving medication to be sure it is effective. Choice number 3, I know that pain in the older client might manifest as sleep disturbance or depression. Number 4, I will be sure to cue into any indicators that the client may be exaggerating their pain. Okay, guys, let's pause for a second. So we need to see what needs to be further taught to this student. So we know pain is highly individualized for some patients. A patient could be laughing and say their pain on a scale of 0 to 10 is an 8. So for the first choice, that's incorrect. The next choice said, I should follow up after giving medication to make sure it is effective. You always want to reevaluate a patient's pain after receiving pharmacological or non-pharmacological interventions to make sure that they receive some type of comfort and relief at least 30 minutes after. So we know that's not the right choice. Number 3, I know that pain in the older client might manifest as sleep disturbance or depression. So that is true. Some older clients, due to their pain, might have a sleep disturbance or depression. Number 4, I would be sure to cue any indicators that the client may be exaggerating their pain. Okay, again, we do not disregard anybody's level of pain or their pain tolerance because every patient pain experience is different. So that would be the answer choice because it's incorrect. It's disregarding how that patient is tolerating their pain. Okay, good. Next question. A client with diabetes mellitus has a glycolated hemoglobin A1C level of 9%. On the basis of this test result, the nurse plans to reinforce teaching the client about which need for which measure. So you guys, we're going to look at the hemoglobin A1C of 9%. So the answer choices are 1, avoiding infection, 2, taking in adequate fluids, 3, preventing and recognizing hypoglycemia, 4, preventing and recognizing hyperglycemia. Okay, guys. So we do know that a normal hemoglobin A1C range is from 4% to 6%, correct? Okay, so we know diabetes mellitus deals with blood glucose. So we know that we do not need to reinforce teaching on infection nor adequate fluids. So this brings us back to choices 3 and 4, which is preventing and recognizing hypoglycemia and preventing and recognizing hyperglycemia. And like I said before, a normal hemoglobin A1C is 4 to 6. So that brings us to answer choice number 4, preventing and recognizing hyperglycemia, because a level of 9% hemoglobin A1C lets us know that blood glucose is elevated. So 9% is high. So we would select the choice that says preventing and recognizing hyperglycemia. Question. The nurse has completed diet teaching for a client who has been prescribed a low sodium diet to treat hypertension. The nurse determines that there is a need for further teaching when the client makes which statement? So the need for further teaching means that we need to it is telling us that that statement is incorrect. Okay? Number 1. This diet would help lower my blood pressure. 2, fresh foods such as fruits and vegetables are high in sodium. 3, this diet is not a replacement for my antihypertensive medications. And 4, the reason I need to lower my salt intake is to reduce fluid retention. Okay, so we're going to go through each answer choice and narrow them down to get the correct answer. So we need a need for further teaching about the low sodium diet. So a low sodium diet, it definitely will help lower blood pressure because it helps you prevent holding on to fluids, okay? Second, fresh fruits and vegetables are high in sodium, and that's incorrect. They are actually low in sodium. Canned fruits and vegetables are extremely high in sodium. So that's the correct answer, but we're going to still go over the last 2. This diet is not a replacement for antihypertensive medications. That is true because you still want your patients to not only follow the diet, but take their antihypertensive medications. You never discontinue medications without a doctor's order. And 4, the reason I need to lower my salt intake is to reduce fluid retention, and that's true because the more salt you have in your body, the more water, aka fluid, that your body holds on to. All right, guys, I hope this studying is actually helping you guys. and not boring y'all. I promise you, if you just stick to using Saunders and the Hearst, it will definitely get you through the NCLEX. I promise. Brings us to a question that can also be popular on the NCLEX: when a nurse must know their roles and duties. The nurse arrives at work and is told to report to float to the pediatric unit for the day because the unit is understaffed and needs additional nurses to care for the clients. The nurse has never worked in the pediatric unit. Which is the appropriate nursing action? So guys, this nurse has no experience at all at the pediatric unit. So let's see the choices. Number 1, call the hospital lawyer. Number 2, call the nursing supervisor. Number 3, refuse to float to the pediatric unit. 4, report to pediatric unit and identify tasks that can be safely performed. Okay, guys. So, when you're a nurse and faced with this situation, you should always identify the potential harm that can be brought on to a client that is in your care. You definitely would not call the hospital lawyer or call the nursing supervisor or refuse to float to the pediatric unit, because you cannot refuse care on a patient just because of the understaffing problems there. And you cannot legally refuse to take care of a patient unless you are with a union that has a contract that guarantees that the nurse will not float to another unit. So you would actually go to that unit and do tasks that can be safely performed and not harm the patient. Because this patient, if you refuse, they might not get any care at all and end up having something detrimental happen to them. So you would definitely report to the unit and identify the tasks that can be safely performed. So this brings us to, like I said before, something that may occur very popular on your test, which knowing your delegation and your roles, whether it's the LPN or the LPN assigning tasks to the UAP. Okay. The nurse is planning the client assignments for the day. Which is the most appropriate assignment for the unlicensed assistive personnel, UAP? Choices. Number 1, a client who requires wound irrigation. 2, a client who requires frequent ambulation. 3, a client who is receiving continuous tube feedings. And 4, a client who requires frequent vital signs after a cardiac catheterization. All right. So we have to choose the most appropriate assignment for the UAP. So we definitely would not give a client who requires wound irrigation to the UAP because they cannot perform that. That is a nurse duty. A LPN or RN can only do wound irrigation. 2, a client who requires frequent ambulation. Yes, that would be the answer choice. A UAP can actually do frequent ambulation with the patients, bedside commode assistance, bathroom assistance, things of that nature. A UAP can do anything that's not invasive and it's nothing that deals with giving medication. Number 3, a client who is receiving continuous tube feedings, they definitely would not get that because only a nurse is allowed to give continuous tube feedings, and you have to check residual. You have to make sure that the feeding pump is running at a certain rate in the volume to be infused. And number 4, a client who requires frequent vital signs after a cardiac catheterization. So because this client requires frequent vital signs after cardiac catheterization, which is like a major thing, you definitely would not assign that UAP to that because they can't determine those things, whether the vital signs are safe or not. It would be different if they were just getting the patient, like a patient on the unit, vital signs during your shift when you can't go access them, only if it's not a patient that's in critical condition or have this type of condition going on. The nurse employed in a long-term care facility is planning the client assignments for the shift. Which client should the nurse assign to the UAP? Answer choices. Number 1, a client who requires a 24-hour urine collection. 2, a client who requires twice daily dressing changes. 3, a client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. 4, a client who has been placed on a bowel management program and requires rectal suppositories and a daily enema. So, we are the nurse and we have to assign the patient that the UAP can actually handle and do things that are in that UAP's role. Number 1, a client who requires a 24-hour urine collection. That is appropriate. A UAP actually is able to measure the urine output and collect it, put it in the container, keep it on ice, so they're allowed to do that because it's not invasive. 2, a client who requires twice daily dressing changes. You would not give that patient to a UAP in the NCLEX world because the nurse is required to do the dressing changes because they have to assess for drainage, have to measure the size of the wound, if the drainage have an odor, what stage it's in, things of that nature. Number 3, a client with diabetes mellitus who requires daily insulin and the reinforcement of dietary measures. You would not give that patient to a UAP because they cannot administer meds, and they definitely are not educated on how to educate a patient on dietary measures. It is the nurse job to educate a patient on their diabetic diet, not the UAP, the nurse, because nurses go to school to learn how to educate a patient. Number 4, a client who has been placed on bowel management program and requires rectal suppositories and daily enema. That would be also a nurse's assignment because a client who is on a bowel management program, the UAP can only assist them to the restroom, but they cannot administer an enema or suppository because that is a medication and that is done specifically by the nurse. Priority question when actually taking care of clients and seeing which client you must see first, whether it's in a hospital setting, a nursing home setting, and what have you. So this is prioritizing patient care. The nurse is assigned to care for 4 clients. When planning client rounds, which client should the nurse check first? 1, a client in skeletal traction. 2, a client who's dependent on a ventilator. 3, a post-operative client preparing for discharge. Or 4, a client admitted during previous shift with a diagnosis of gastroenteritis. So we know that airway is always important. You always follow your ABCs: airway, breathing, circulation. So the correct choice would be a client who's dependent on a ventilator because their airway is somewhat, you can say in so many words, obstructed. They're depending on this ventilator for oxygen. A client in skeletal traction, they're in traction. I think that would be the next patient you check out because you want to make sure that the traction is in proper position. You want to make sure the patient is comfortable. If they're in any pain, you want to assess that and get that done. A patient that's preparing for discharge, that would be the last patient you see because they're actually going home. They're stabilized. And then a client during a previous shift with the GI situation, that would be your third person because they don't have anything invasive going on, but you do want to check into their labs. Last question of the night. I promise you I will be doing more Study With Me NCLEX Prep 2020 very soon. I'll try to do this if this actually is helping some of you guys. I definitely, before I get off, I want to talk to you guys about labs and how important they are. So this question is, the nurse employed in the emergency department is assigned to assist with triage of clients arriving to the emergency department. The nurse should assign priority to which client? Number 1, a client complaining of muscle ache, headache, and malaise. 2, a client who twisted their ankle when they fell in line skating. 3, a client with a minor laceration on the index finger sustained while cutting an eggplant. And 4, a client with chest pain who states they just ate pizza and the sauce was very spicy. So guys, as I told you guys before, you're always going to follow your ABCs: airway, breathing, and circulation. the biggest alert is the patient who has chest pain, because you always want to rule out a MI and then go from there, because chest pain can indicate a MI. All right, guys. Well, I hope you enjoyed this video and that this helped you guys. I would definitely be giving you guys more content. Just like, comment, and subscribe. Let me know if this is helpful. Let me know if there's any other areas that's more important for you guys to cover that may be you guys' weakness. I'm here to help y'all. And I definitely hope to see you guys soon.